I'm Dr. Brian Nickel, your cannabis expert for CannabisExpertMD.com. Today we're going to be talking about treating osteoarthritis with cannabis. Osteoarthritis, this is inflammation of the joints. It's very common wear and tear type damage, often referred to as degenerative joint disease. The nice smooth cartilage lining of the joints over time breaks down, wears down. Instead of the joint being able to slide very smoothly, you get the rough bony surfaces opposed to each other, creating inflammation and pain. Now, osteoarthritis, of course, can occur in any joint in the body. It most commonly occurs in the large joints that bear a lot of weight. Shoulder joints, elbow joints, hips, and knees in particular are commonly affected. Hand joints in people use them all the time. People that do use their hands as an occupation will see a lot of arthritis in the finger joints. Lots of different ways we typically treat osteoarthritis. Topical application of nonsteroidal anti-inflammatory medications is very commonly used. Patients consume a lot of over-the-counter medications, whether it's ibuprofen or Tylenol, in an attempt to alleviate some of these symptoms. We prescribe a lot of nonsteroidal anti-inflammatory medications to patients, and even steroids on occasion for severe symptoms. Some patients are prescribed narcotics to treat the pain symptoms, and while it does help with the pain, it really doesn't affect the underlying etiology of this disease, and there are complications and risks associated with narcotic use. As a result, many patients are looking for alternatives. Many patients are looking at medical cannabis to reduce or perhaps eliminate the use of over-the-counter or prescribed medications to treat these symptoms. So medical cannabis is an alternative for many patients. It comes down to, what are you going to use, though? There are many different products available, and how are you going to use them? Let's look at, first off, the cannabinoids involved. THC, that is the cannabinoid that provides the euphoric effects with cannabis. THC does have some anti-inflammatory properties that are useful. It does have its own pain-relieving properties that are quite useful in treating osteoarthritis. CBD, now that's probably the most important cannabinoid in addressing osteoarthritis. CBD works indirectly in the endocannabinoid system to bring down inflammation. Inflammation is the root cause of pain in osteoarthritis, and by addressing that, you can really improve the symptoms a patients experience. Now, CBG, a relatively rare cannabinoid, or previously rare cannabinoid, found in low levels in cannabis. It's an extremely potent anti-inflammatory cannabinoid, however. A little bit of it in whole plant extracts does help the CBD be more effective. I usually suggest now that it is available in its native form. I suggest patients that have very, very severe inflammation or autoimmune arthritis add CBG to this regimen. And that is because a combination of CBD and CBG, working through slightly different mechanisms of action, work together synergistically to bring down severe inflammation. And of course, we do have to consider terpenes in cannabis. We know how important terpenes are in leveraging this entourage effect. Rather than go through the whole litany of them and what may be present in cannabis or may not, let's stick with the top two that would be important for osteoarthritis. They also happen to be the two that are most common in most strains of flower available today. That would be beta-caryophyllene. Beta-caryophyllene works on the endocannabinoid system, unlike most terpenes, to bring down inflammation. The myrcene terpene, this one has its own anti-inflammatory properties, but more importantly, has some of its own analgesic effects that help relieve some of the symptoms with osteoarthritis. Now, we are talking about using the combination of THC, CBD, and possibly CBG with these terpenes as we try to leverage the entourage effect. We do talk more about the entourage effect in just about every video we've ever produced. But the entourage effect, just very quickly, it is how the combination of cannabinoids and terpenes work together synergistically to produce a superior, response in patients compared to using the isolated individual chemicals. And it's getting that combination right is how you get the maximum and best effect you can using cannabis as medication. Topical cannabis, that's very, very easy to use. Most patients will do fine with just a whole plant extract, CBD topical. For patients that have very, very severe disease or nerve pain components to this, that would be if you have a lot of burning, shooting, tingling pain associated with the osteoarthritis. You're going to do better with a THC component to that. There are some commercial tinctures available, such as this 3-to-1 CBD to THC topical that Natural State Medicals produces here in the state of Arkansas. As far as topicals go, they have advantages to them. The advantages are very, very focused delivery of medication. It's going to work on the joint you apply it to. There are no systemic effects. The cannabinoids you're going to absorb will not affect your headspace. They work relatively quickly, setting up in anywhere from 5 minutes to 20, 30 minutes in time. Very effective for superficial joints. It's not going to really penetrate that deeply into hip joints or the spine typically on patients. Look for another way of using the cannabinoids in those situations. Disadvantages, again, not practical for widespread symptoms. If every joint in your body is hurting, it's not going to be really practical to put topicals on that all day long. Again, it's only useful for superficial joints. It can leave a little bit of a greasy residue that people don't like, and it will require repeated administration throughout the day. How do you use them? They're pretty easy. You just put it on those joints that are bothering you whenever you need it. You're going to probably have to use it anywhere from 4 to 6 times a day to get really maximum effects on this. If you're having nerve pain symptoms, you might want to consider using one of the topicals that contains additional THC, as that will be more effective. Tinctures. Now, tinctures are usually my preferred method of treating osteoarthritis. Tinctures are liquid extracts of the cannabis plant. We really pull all the chemicals we're interested in out of the plant, concentrate them in the liquids, and you consume that instead of the plant material. Big advantages to tinctures, well, they're very easy to administer. Just put a little bit underneath your tongue. There is no environmental contamination. There's no smoke involved, so they tend to be quite discreet. They're relatively fast acting, setting up anywhere from 15-20 minutes out to maybe 45 minutes in most patients, which makes them very simple to titrate to effect. They do have a longer duration of action than inhaled cannabis, which has a tendency to make them better for longer-lived symptoms such as osteoarthritis. Also has a tendency to make them more cost-effective also. Disadvantages are few. Sometimes they have an unpleasant flavor that people don't enjoy. On some patients that are sensitive to them, the medium-chain triglycerides they use, that would be the organic coconut oil, that in some patients will cause abdominal cramping and occasional diarrhea. One thing I always have to caution people about is with CBD tinctures and all CBD products, really, be sure to vet your sources being legitimate. There are a lot of bad players out there. It's an unregulated market. You have to vet your CBD as being a legitimate product. One of the things that I do want to mention about using tinctures is a way to leverage this entourage effect. Additional THC usually does help the tinctures work better. Typically, on most patients with osteoarthritis, you will not have a very high THC requirement to treat your symptoms. And you can kind of supplement the little bit of trace THC in these whole plant extracts with inhaled THC around the doses. Here's a graph I have kind of explaining this. It's simplified out quite a bit, but it shows the differences in blood levels of cannabinoids based on routes of administration. The inhaled route of administration, indicated by the black line here, shows a peak blood level occurs very, very quickly after inhalation of THC. Most people do feel the effects within a minute or two. Hour later, most of the effects are gone, and blood levels follow a similar pattern to that. If we look at the tinctures administered sublingually, we see a peak blood level about 15-20 minutes on most patients. It takes about 2 hours before it's completely cleared from the bloodstream. What I suggest you do in order to leverage this entourage effect is when you do use your CBD and possibly CBG tincture dose sublingually, do the dose underneath your tongue, hold it there 60 seconds for absorption to occur. Then smoke a little bit of flower or inhale a little bit of a vape cartridge to get some THC in your bloodstream. I do tell patients you do not have to get high unless you want to. Just get a little bit of THC in your bloodstream. That will activate the THC or the CBD tincture so that it does work better. You're going to want to redose with inhaled cannabis at 45 to 60 minutes later. This is going to ensure you have adequate THC circulating into your bloodstream over the entire time that the tincture cannabinoids are circulating in your bloodstream. This will leverage the entourage effect and give you a better overall clinical experience. One quick comment about CBD tinctures in particular. There are two main categories of this. There is isolate or single molecule CBD. Now, this is the CBD tincture that contains only the CBD molecule in there. There are no other cannabinoids nor terpenes. And then there are whole plant extracts. Now, these, of course, have the CBD molecule just like the single molecule stuff does. In addition to that, you will find some of the other cannabinoids and minor cannabinoids present. There will probably be some cannabichromine, the CBC cannabinoid present. There may be a little bit of CBG. There will probably be some CBDV present, some trace THC. Certainly some terpenes will be present other than the two I mentioned. Now, all of this adds together to really provide a superior clinical response in patients. We see in patients that use whole plant cannabis or extracts of the whole plant compared to the isolated molecules themselves. Patients that I've seen using single molecule CBD that may require several hundred milligrams a day to see some type of a symptom improvement. When I switch them over to a whole plant extract, they may use 32, 48 milligrams a day of that, getting even better symptom improvement. That is strictly because of the entourage effect and why I only recommend whole plant extracts to patients. As far as using flower to treat osteoarthritic symptoms, lots of advantages to flower, well, several. Very simple for people to use. The apparatus to use it is of relatively low cost and it is fast acting. Being that fast acting, it's very easy to titrate yourself to the required effect. Disadvantages, well, smoking flower can be irritating to the throat and the lungs. It's not very discreet. It does cause environmental smoke. Everybody's going to know what you're doing. And it's not a terribly efficient way to use cannabis, with up to 70% of the cannabinoids and terpenes can be lost through the combustion process. Flower strains I would suggest you use to treat osteoarthritis as far as on the THC side, that would be strains, of course, that are high in beta-caryophyllene and myrcene. Morris Code by Natural State Medicinals, very good choice, high in both of those terpenes, a little bit more on the sedating side. Purple Sunset, another good choice, high in beta-caryophyllene and myrcene. And of course, Skunk Shocker, that has quite a bit of both of those terpenes in there and should be a very good choice for osteoarthritic symptoms. I do suggest you using additional CBD with the THC. The tinctures are the easiest way to add CBD in your regimen, but you can also use CBD flower. It is available. I suggest you really vet your sources as far as price and in particular quality goes. It is available in the state. Very oftentimes you are going to have to order it online. In addition to getting CBD flower, CBG flower is also available. Here's a specimen I've used before, white CBG flower, also very, very nice strain. It runs right about 14% CBG. Now, as far as flower, how are you going to treat yourself with flower? Well, you're going to start with a chemovar high in beta-caryophyllene and myrcene terpenes. You're going to probably have to dose every 3 to 4 hours really to get the best effects. Mixing the THC flower with CBD flower in about a 1-to-1 ratio is really recommended to get the most anti-inflammatory properties you can from this particular treatment. Patients with very, very severe inflammation or autoimmune arthritis, you're going to benefit by the addition of CBG in this regimen. Again, if you're not going to use tinctures, get yourself some CBG flower. Use a 1-to-1 ratio of THC flower to CBD flower to the CBG flower. As with everything in inflammation, maximum responses occur roughly about a week. Remember that the combination of THC with CBD is going to be much, much more effective than the THC flower alone at addressing your inflammatory symptoms. When you add CBG in the mix, it will be even more effective. When it comes to flower mixing that I'm talking about here, here's a very easy way to do it. It's going to illustrate doing flower mixing on your grinder. This shows a sour tangy bud mixed with a sour space candy and a CBG flower. In this case, it was white whale. Sour tangy's right about almost 19% THC. Sour space candy about 15% CBD. White whale right about 14% CBG. For our purposes, about the same size buds. 1 to 1 to 1 is going to give you an approximate 1 to 1 to 1 ratio. What you do is put those on your grinder, give a couple turns, shake it 2 or 3 times, and you've just created a 1 to 1 to 1 THC, CBD, CBG flower that is not being grown in the state of Arkansas at this time, and actually, genetically, the plant is incapable of producing. This combination is going to address your symptoms much, much better than the THC flower alone. So as far as topicals go, one more time, it's going to be useful for joint pain in specific or superficial joints. You're going to want to use a CBD dominant formulation unless you have a lot of nerve pain components to this. And make sure your topical is from a whole plant extract to fully leverage the entourage effect. Tinctures. Now, tinctures are probably the most useful way of treating osteoarthritis, in my opinion. It can be very useful for deep joint and widespread symptoms. Be sure you use a whole plant extract to leverage the entourage effect. Additional THC will be of a benefit. You can use a little bit of inhaled THC around the doses to leverage the entourage effect. Or you can look at the topicals that contain additional THC to pick up nerve pain components. CBG will benefit patients with autoimmune disorders or very, very severe inflammation. As far as flower goes, you are going to use a THC flower chemovar with high levels of beta-caryophyllene and myrcene. Those are going to be the 2 ones you're going to look for primarily. Fortunately, most of the strains available do have significant levels of both of those. You will want to do the flower mixing like we talked about to leverage the entourage effect. Be sure you use at least CBD with it in a 1 to 1 ratio with your THC flower. A 1 to 1 to 1 ratio with CBG flower will probably be even more effective. So that's how you get started on using cannabis to treat osteoarthritis. You should see an improvement in your symptoms as you work and figure out how this works best for you, and hopefully you'll be able to return to normal activity in life. I do direct you towards a couple videos here on YouTube. If you search for our handle there, Cannabis Expert MD, one of the videos there is called Medical Cannabis Information for Patients. It is our baseline medical education video. We'll fill in a lot of the blanks that I kind of skipped over here as far as how the entourage effects works and the importance of terpenes. For anybody that wants to get a little bit deeper into it, another video you may enjoy is called Medical Cannabis Essentials. Presentation I did for the Arkansas Registered Nurses Association this fall. It's kind of an introduction on how you use cannabis as a medication. And we've got lots of other informative and hopefully entertaining videos on YouTube. We're also available on Instagram, YouTube, of course, Facebook, Twitter, the Gab application, and Relevant. Be sure to check us out there for more information on all things medical cannabis.